Hey everyone! Welcome back to our channel today. We're talking about a health issue that's critical to know about, colon cancer. It's one of the most common types of cancer, but when caught early, it's also one of the most treatable. The problem is, the warning signs can be easy to miss or even go unnoticed until later stages, so awareness is key. Colon cancer doesn't always come with obvious signs. And while the risk does increase with age, it can affect younger people too. In fact, more and more younger adults are being diagnosed with colon cancer, which makes it even more important to pay attention to your body. So, in today's video, we're going to break down the warning signs and hidden symptoms of colon cancer, signs that you may not even realize are connected to this disease. Let's start with one of the most common yet easily overlooked symptoms, abdominal pain. A dull ache or cramps in the abdomen that persist for weeks may be an early warning sign. This pain can be constant, or it might come and go. Sometimes it may be mistaken for something as simple as indigestion or bloating. But if that discomfort doesn't go away or seems to worsen over time, it could be related to the growth of tumors in the colon. Tumors can block or partially obstruct the colon, leading to pain and bloating. If this happens regularly, especially with other signs, you should definitely bring it up to your doctor. Next, let's talk about something many people feel uncomfortable bringing up, changes in bowel habits. These can be some of the most noticeable symptoms of colon cancer, but they're often dismissed as temporary digestive issues. Changes in the frequency or consistency of your stools can be an early warning sign. This could mean experiencing diarrhea or constipation that lasts for more than a few days or alternates between the two. A common symptom of colon cancer is feeling like you haven't fully emptied your bowels after using the bathroom. If these changes last for more than a couple of weeks, it's important to talk to a healthcare professional. Colon cancer can lead to partial blockages, which may change the way you pass stool and cause you to feel like you need to go more often. Now, let's talk about blood in the stool. This is one of the most alarming symptoms, and understandably, it can cause a lot of concern. However, it's important to know that blood in your stool doesn't always indicate colon cancer. It can also be caused by hemorrhoids or anal fissures. But if you notice any blood, whether it's bright red or darker and tarry, it's something you can't ignore. Bright red blood often means that the bleeding is closer to the rectum, while darker blood could indicate that the bleeding is higher in the colon. Either way, if you notice blood, it's essential to get checked by a doctor. Even small amounts of blood over time can signal a developing tumor. And even if the blood is occasional or doesn't seem like a lot, don't dismiss it. It's better to be proactive and have a professional look into it. Unexplained weight loss is another symptom that many people miss. If you're losing weight without trying, meaning no changes to your diet or exercise routine, it could indicate that your body is fighting cancer. Tumors in the colon can interfere with your body's ability to absorb nutrients properly, leading to unintended weight loss. Colon cancer can also cause your metabolism to change. This may lead to malnutrition or fatigue. If you notice a drop in weight, coupled with any of the other symptoms we've discussed, it's time to see your doctor and get checked out. Fatigue is another symptom that may accompany colon cancer, especially in its later stages. You might feel constantly tired or weak, even after a full night's rest. This happens because cancer cells can drain your energy, and the blood loss from tumors can also lead to anemia, which makes you feel more fatigued than usual. While fatigue is a common issue in today's fast-paced world, it's worth paying attention to if it's unexplained and ongoing. If you're feeling persistently worn out, combined with other symptoms like changes in bowel habits or abdominal pain, don't ignore it. While the symptoms are important, so are your risk factors. If you have a family history of colon cancer or other types of cancer, like ovarian or uterine cancer, your risk could be higher. Colon cancer can run in families due to inherited gene mutations. Even if you don't have a family history, other factors can increase your risk, including being over 50, a sedentary lifestyle, smoking, a high-fat diet, or being overweight. If any of these apply to you, it's important to talk to your doctor about starting screenings earlier and perhaps more frequently. So, what can you do to protect yourself? Regular screenings are the best way to catch colon cancer early. The most common method is a colonoscopy, which involves a doctor using a long tube to view the inside of your colon. It's recommended that people with an average risk begin screenings at age 45. If you have a family history or other risk factors, your doctor may recommend starting earlier. Other screenings, like stool tests, can also detect early signs of colon cancer. The key is to have these discussions with your doctor and stay on top of your health. The earlier colon cancer is caught, the more successful treatment tends to be. Colon cancer is serious, but early detection can make all the difference. If you notice any of the symptoms we discussed today, don't wait to see a doctor. Trust your body and prioritize your health. It could save your life. Make sure to talk to your doctor about your risk factors and get regular screenings. And if you found this video helpful, please give it a thumbs up, share it with your loved ones, and don't forget to subscribe for more health tips. Thanks for watching, and remember, your health matters.